So I think I would like to understand, probably first of all from Dr. Gray Johnson. There's a statement you made, and I think I loved it. You said, there's a clear path. You're not shooting in the dark. And of course, I look back at the data, and I see that the new global AIDS strategy for 2021 to 2026 is saying that will require around 29 billion plus US dollars to be able to support in rolling back the cases or working on rolling back HIV and AIDS. And yet we hear of the 1%, we're clearing the less than 25% in local investment. What will we need to be able to get this financing taps flowing from the local financial institutions?
Okay, so you looked at me, but you mentioned
okay,
Dr.
sorry. I think our eyes, people with glasses, it's Go ahead, please. Yeah.
And you can start, then I can comment. Yeah.
Well, thank you so much. I think what we are saying is that we have seen that where countries have taken the leadership and the investment in health systems, and what I appreciated about Dr. Mohamed's presentation is the emphasis of Rwanda's program on primary health care. And we were here during Women Deliver recently and visited your clinic. I have to remember the name, but it was about an hour's drive or so away. And what was impressive was to see how well integrated the services were. I mean, we went to see how young women and girls services have been provided, but we also recognized that in the same facility for health, they also had social services that are linked to violence against girls, but at the same time, there was treatment for children, and the facilities were so well organized that it was very clear that this is what we're talking about when we're talking about universal health care and universal health coverage. And so in building these health systems and in investing in domestic resources, the intent is to ensure that we're leveraging the global resources that are coming into countries to establish sustainable health systems that can live beyond any external support that may come, and that can deal with the fact that today, as Dr. Mohamed shared again, we are seeing a real crisis, actually, of non-communicable diseases, when all along our focus was on infectious diseases. So I think what we need is to just continually focus on how we build the health system, investing on those systems ourselves, and not see HIV as a passing cloud. This is an infection that will come and go. This is not Ebola. It's not passing us. It is an opportunity to build systems that can be leveraged across all diseases, but also will leverage other sectors. The better educated we are, the higher the chance of better health outcomes. The stronger our social protection, the same. So really the path to end AIDS is saying, build on the systems, recognize the inequalities, follow the data and evidence, and sustain this HIV investment long term.
Right, thank you. Dr. Rather, not doctor. I think I'm promoting you, yeah? You're one, yeah?
No, I'm not a doctor.
Oh, yeah, so already...
I'm going, I won't be one.
Manifesting, eh? I know I'll come to you, but before that, I want to hear from Dr. Calypso, just kindly. When you're presenting or when you're speaking, Dr. Calypso, you mentioned several things that are giving us the clear picture that we are on today. There's the debt distress. We know we have global shocks in terms of the wars that we're seeing, and they're impacting even the financial flows into the continent. And you even mentioned, and I'll quote you, said the status will get worse in the near future. But you still insisted that we can not remain pessimistic, we need to remain optimistic, and we need to also be positive. But I know you and I agree that nothing will happen with just those two things, optimism and remaining positive. We need to do something about this. And I know someone might say, she's a prophet of doom. Why is she saying that things will remain worse like that? But you're right, it is the reality. So what do we do then? What do we do amidst all this big status that you said?
Thank you. Thank you. And I think, first of all, what we're doing currently here, right now, is really important. This is an action. These are commitments that in the past have led to the progress of experience that's evidence-based, and will continue to do that. I think the political commitment is the beginning, and the end really goes a long way towards actually making a reality this optimism. So it's not just empty words. We see the political commitment, and this translates into action. So that's the first thing to say, and it's not Rwanda alone, but also through the AU, the leadership across the continent. And you cannot overstate the importance of that political commitment under the leadership of the AU. So that's the first thing to say. The second thing to say is, as we've just heard, health is multi-sectoral, it's public, it's private, it's high-tech and low-tech. And COVID taught us this. Countries that traditionally never expected to suffer from an infectious disease did, and suffered badly, even worse than countries that were poorer and traditionally were the ones who had the higher burden of infectious diseases. We've seen how important it is to have a collaboration of public and private sector. We've seen how stronger health systems have helped countries, including community health workers, for instance, where the systems worked well at the community level. We've seen how technology matters, including high-tech. Again, we talk about primary healthcare, and this is very important, but at the same time, we've seen the need to invest in hospitals to have the oxygen supply, et cetera. So I think we need to think more broadly, and I think it would be really bad if we were to forget so quickly what COVID has taught us about the importance of health systems. It will really be detrimental. I mean, if we can see one good thing coming of a catastrophe, the catastrophe that COVID was for health and for the broader economy of the world, is to really understand that health systems matter. So going forward, we cannot give up, precisely because we've been through the crisis we have been through.
Yeah, we cannot give up. I think that's the word. That's the word. I see a hand up, so we'll take it. Say your name and institution, and then I'll come to. Yeah. Okay. Go ahead.
I think it's important that I add on to the momentum on health systems. So I want to make two quick points. First, the positives, and then the negatives. The past 5 years at the continental level, under the leadership of our chairperson, His Excellency Moussa Faki, is the period of which Africa set up the development agencies. So we had the African Union Development Agency, the AFCFTA. Then we transformed ACBF into a specialized agency that deals with capacity building. And then we have Africa CDC. And soon here in Kigali, AMA, the African Medicines Agency, will be established. So this is very, very positive.
Right.
Some 23 years ago, we only had one development agency called NEPAD. So now we have 5. Out of those 5, 4 of them somehow are dealing with health systems. AFCFTA, the top 3 priorities for the AFCFTA is on the pharmaceutical industry, manufacturing, and so forth. Secondly, of course, we have the CDC. Everyone knows what they've done, especially during the pandemic. And we're going to have AMA here. And AUD and NEPAD, we are reorganizing ourselves to look at investments, financing in the health system. So that's very, very, very positive. 2 days ago, we met with the committee of 33 heads of state, which is a committee of special advisors. These are ministers, senior officials, ambassadors of 33 countries. Of course, Rwanda used to chair our Heads of State and Government Orientation Committee, and they are part of it. And we sound the alarm bell of what my sister Anne has just said, and Doctor has just mentioned here. And we put the data up, and we showed that if we continue, look, every government has 100% in terms of their budget. So there's so much we can. We have CADAP 10%, we have infrastructure 5%, of course 15% on health, and we can go on and on and on. We haven't talked about security, we haven't talked about everything that has to go to the budget. But we need to discuss decisively how do we sustain investments, especially domestic investments into our health sector. So we put up the negatives. 95% of our medicines are imported, and 99% of vaccines are imported. Africa only has about 336 manufacturing companies that can produce entry-level drugs, and also that we can't continue the way it is importing these drugs. So those are the negatives. And I think what we want to put through is that under the ALM, great work has taken place. How do we redouble our efforts, get more regional economic communities involved, more countries? We've just had so far 7 to 8 countries. We still, I mean, it's 55 countries. So the work ahead is very important. And I think this dialogue here in Rwanda has solidified the cookbook. Of course, it's not a all size fits all, but we have the cookbook. I think by tomorrow, we can flip the pages and arrive in Gambia or Niger and say, look, this is how Rwanda's doing it. We can do it this way. Because time is not on our side. So I needed to emphasize that this is a very important process. And we, of course, we encourage the dialogue.
Interesting. Wonderful. Let's open the floor now. I'll take a question there. Yes?